Okay, well, let us now move without further ado to opening the conference, and we are very grateful to have Professor Steve Wesselingh, now the Chief Executive of the National Health and Medical Research Council, helping us out with this task. Very briefly, Steve was the previous Director of the South Australian Health and Medical Research Institute and has now taken over from Anne Kelso. Steve was also the most recent Chair of the NHMRC Research Committee. So bringing to this position his expertise and leadership, Steve, we're very grateful to have you. And of course, in the context of this conference, we hope you will continue to support human research ethics committees to the extent possible. So Steve, over to you.
Thanks very much, Gordon, and good morning to all the attendees of the 4th National HREC Conference. And I understand that you've got about 1,500 registered for the 3-day event, which I think is a great achievement. And I'm sure Gordon, Sarah, and the members of the organising committee are quite pleased with that level of interest. Before I start, and really importantly, I want to acknowledge the traditional owners of the many lands on which attendees are joining from. I want to pay my respects to their elders, past, present, and emerging, and to Aboriginal and Torres Strait Islander people who are participating in the conference. Your voices and contributions are really important and valued. As Gordon mentioned, I'm pretty new to this job. I started as CEO of the NHMRC at the end of August, following Anne Kelso, and I think you all know the enormous contribution that Anne made to the NHMRC. Prior to that, I did have some involvement with the NHMRC and chaired research committee for about 6 years, and obviously has worked in the sector for a long time, both leading research institutes and a faculty of medicine at Monash, and even an infectious diseases unit at the Alfred Hospital. So have been interested in clinical research for a long time and really have understood the importance of ethics committees. And as you know, one of NHMRC's core functions as a statutory agency is to promote high quality research and ensure that it's conducted ethically and with integrity. And really, we get our social license because we conduct research ethically and with integrity. And so if at any time we deviate from that, I think that can have major consequences on the sector and on our social license and the public's confidence in the quality of the research that we do. We have a number of principal committees, but a really important principal committee is the Australian Health Ethics Committee, HREC, and it's highly regarded, and I'm really grateful for the guidance that it provides. And I'm sure AHEC would be pleased with the breadth of topics for discussion over the next few days. Human research ethics committees will continue to play a really important role in promoting good research and protecting participant safety. Ensuring that the information that's given to the participants in a way that engenders and supports valid consent is a really important issue and will continue to be a major challenge. And in fact, will become even more challenging as technology becomes more advanced and all of the amazing research that people supported by NHMRC and other agencies are doing. But that research is generating ideas and concepts which ethics committees need to understand and work with. And so that's a really, really important issue. Because of that, I'd like to take this opportunity to thank all the HREC members for the valuable work that they do on behalf of all of the participants in research, but not only the participants in research, all researchers, because without HRECs, we really couldn't do the research we want to do. NHMRC couldn't fund that research, and we wouldn't, as I mentioned, have the confidence of the public. As you know, the NHMRC recently released the 2023 National Statement introducing changes to how risk is understood and assessed. The concept of risk existing as a continuum potentially provides greater flexibility to institutions and HRECs in the way they consider risk and classify research proposals submitted for review. An example is the potential for some clinical trials to be considered low risk, enabling more efficient review and proportionate monitoring. I think this is a really important step forward. NHMRC is also currently reviewing submissions to a public consultation on Section 4 of the National Statement, and we are hoping to be able to release an update to the 2023 National Statement sometime in 2024. So lots to look forward to. I've looked at the conference program, and there really is a diverse range of topics included in the program, which I think are really important. One of the areas is consumer involvement. I'm really pleased to see the program include a number of sessions devoted to consumer involvement, lived experience, inclusion, and diversity. NHMRC considers these issues to be central to the conduct of ethical and high-quality research. So really admire those sessions and really looking forward to hearing about them. There's a workshop on AI apparently today on day one, and I think that's firstly going to be really interesting, and secondly, really, really important. AI is going to bring a lot of challenges to the research sector, but also enormous advantages. And here at NHMRC, we're looking at this really carefully, developing our ideas, developing workshops to look at AI, to look at the benefits of AI for research, but also looking at the ethical issues and other important issues that impact on research and participants in research in regard to AI. And I see the future as both exciting and worrying. And we have to take advantage of AI, make sure that our patients and our research benefits from artificial intelligence, but at the same time, we do that safely, fairly, equitably, and make sure that we really do understand any of the unintended consequences of utilizing AI in our research. Despite NHMRC's support and the multi-year review of the national statement, we recognise there's also a need to improve support for HRECs. And on that front, I think it's timely that the Australian Commission on Safety and Quality in Healthcare have been tasked with reviewing the National Mutual Acceptance Scheme operated by the states and territories. And I also note that Dr. Conor Brophy, chair of the QUT HREC, is taking on this topic. I think that's a really important issue. So in closing, firstly, again, thank you to all of the HRECs for all of the fabulous work they do. And again, I just want to emphasize that you're such an important part of the research process and the research sector. So thank you so much. I also want to congratulate you on developing such a great meeting with some really important topics for discussion. They're topics we're discussing here at NHMRC, and I'm sure are being discussed around the world. And I think a lot of good will come out of the meeting, and really interested to hear about the key outcomes. And finally, thank you, Gordon, for asking me to open. HRECs are so important that I didn't hesitate but say yes. So thank you very much, Gordon.
And Steve, thank you so much for your time. Really a pleasure for you to open the conference, and thank you for your wise words. We're always very grateful to have someone of your caliber and of the NHMRC as a statutory agency recognise the value of HRECs. I do agree it's a very diverse programme. Hopefully some of your team will be attending. I'm fairly sure Jeremy Kenner will be online somewhere. Hello, Jeremy, if you're there. Always happy to speak to you about what HRECs can do to help the NHMRC and, of course, any participants in research. So with that, Steve, and without further ado, thank you very much for your contribution. And we will now, I guess, consider the conference open.
Thank you very much, Gordon.
Thank you, Steve.